Sure. So I think one of the most common misconceptions about breast cancer or cancer of any form is that people think that it can't happen to them. I certainly thought that. I mean, I went for just a routine mammogram, not thinking there would be anything wrong at all. And then, the next day I get the call, and then everything really spiraled from there. But the reality with breast cancer is that 1 out of 8 women in America will get it. And so for the kids in the classroom right now, if you count off the girls by 8, that's statistically where you are, and then everybody else in the class knows those people. So you will know someone or be a person yourself who is impacted by breast cancer because it is so prevalent in our society. So like I said, I went in for just a routine mammogram. I expected nothing to be wrong. I didn't feel any different. I was no concerns. And when I went, I got a call, the next day to come back in. And then for any woman out there who's ever gotten that call, it is like your whole world just sinks. And so I went in and had a more thorough test, and that determined that there was something very suspicious. And then I went in for a biopsy, and right then the doctor came in, and he brought someone with him. So I knew that it was going to be bad. When they bring someone in the room to break the news to you, then you know that you're in trouble. And the biopsy had detected that I had breast cancer. So there are many things that I realized going through this situation, and one of them is that I'm a lot stronger than I ever thought I could be. I mean, you get to a point where you have to keep moving on because there is no choice but to just keep moving on. And so even though I wouldn't want to go through the experience again, I have grown so much. I've grown so much from just the strength that I was able to find in myself. And to those people sitting out there listening, like, you are so much stronger than you think that you are, and you can get through whatever you need to get through, that's for sure. So that's a really interesting thing, thinking about how you carry it with you. Because I think about Tim O'Brien's The Things They Carried, and just how people do carry these incredible weights and challenges that they are faced with. And I guess the thing I would say is that you never walk alone, and you never carry these things alone. Having cancer is so lonely. Until you actually have it, you cannot imagine just the isolation that you feel inside. And even though I was so lonely, I was never alone. I can't believe, I'm still humbled and still in awe by the incredible support from my NEQA family, from my own family, just from the community. Kelly Simon, freshman teacher, is a force to be reckoned with when it comes to support. And Mr. Rossi took off a day of work to come and sit with me through chemo. Mrs. Snyder drove through a blizzard the first day of Christmas break just to bring me a hot chocolate and sit with me for my last chemo. Like the things that people will do to step up to help you, I still can't believe just how lucky I am to have all these people and all this support in my life. I would say that be there, just show up for people. I had so many people who offered to help, and as the one with cancer, in the beginning it was really hard to say, okay, you could do this for me, or I would appreciate this. But I think if you're struggling, then accept the help, because people want to do something, and so let them do something and let them know what they can do. And as far as people on the outside who want to help, just be there. You don't have to know what to say. Just show up and be there, and let people know that you do care. It's okay not to know what to say, but not saying anything, that's hard. Just be there. Yeah, I had absolutely no symptoms whatsoever. Like I said, I went yesterday actually for my 18-month blood draw, and pulling into the cancer center, I still could not believe, I can't believe that I'm pulling into the cancer center, even now after I've been, so much time has passed. I think that there weren't really any symptoms. Yeah, there was nothing. I didn't have any symptoms going into it, which is why having a mammogram, if you feel like there's anything off, you need to get things checked out, no matter what it is, simply because cancer doesn't clear itself up. It only gets worse. So it's very easy to be scared and to not want to do anything because you're scared of what the results might tell you, but it's only going to get worse. So you have to step up. And like I said earlier, like, you are stronger than you know, and you can get through, these difficult things. So for the type of cancer I have, basically with breast cancer, there's a lot of different types, but there are two general types. One of them is hormone active and one of them is not. And so 15% of women have the kind of breast cancer that I had, which is HR negative. And that means that starving it from hormones does not affect it. You have to go in and literally blast it, is how my oncologist explained it. So, once I was diagnosed, the process of getting me into chemo, it went so fast. Within probably a week, I had a port put into my chest, and then within 2 weeks, I started chemotherapy. The chemo that I had is called adriamycin. It's called the Red Devil. So my infusion nurse had to actually wear a hazmat suit in order to administer it. And it is a bright red color, but it literally kills everything in your body. And so I was on chemo for 4 months. My last time was the day before Christmas Eve. And so I did chemotherapy, and then as soon as that was over in January, I started this in September. And then in January, when I had my surgery, is when I had stopped. Something that's interesting is that this is kind of out of the way, but I just thought of this, when I got the call saying that there was something suspicious and I was going to have to go in for the biopsy, it was literally right before I was about to walk in to my 5th hour AP English class to introduce myself on the first day of school. So I get the call, I saw where it was from, I'm standing out in the hallway, I have to take it. And so then the woman on the other end told me that I needed to come back because there was something suspicious. And then the bell rings and I walk in, hi, I'm Mr. Besick. And so, talk about being a good actress. That was something that was, yeah. The hardest part though about being diagnosed with breast cancer was having to tell my kids. Because my father had just passed away from a very quick and aggressive, deadly form of brain cancer, and so that was our family experience with it. And then within a year, then I'm diagnosed, and so having to sit down with my children and tell them, and tell my mom, that was the hardest part. Worse than going through chemotherapy was having to tell my kids. I think just be aware that people want to help you, and we all have our own story and we all have our own cancer experience, and people are going to say things and they're going to want to do things to help you, and some of it is going to be awesome and sometimes it's going to be, depending on how you feel, you're not going to want to accept that help, but you just have to know you're never alone in the fight. There are warriors who are fighting with you in any way that they can, and people are so good and they will take care of you, and you just have to let them. Sure. So, some of the things that I take away from this. So when I was first diagnosed, it was terrible. I felt my whole world just was falling apart. And there's that phrase, everything happens for a reason. And I hate that phrase because of course everything happens for a reason, But in hindsight, when I look back at my experience, number one, I'm glad it happened to me, as opposed to any other woman, my daughter, my mom, anybody I work with. I'm glad it happened to me because I can handle it, and it has made me such a better person coming out of this on the other side. As a teacher, I've been teaching for almost 30 years, and I feel like I can empathize with pretty much every experience that my students are facing, but having cancer is very different from knowing someone who's had it, and it gave me this I don't want to say edge, but it just gave me this whole new perspective to connect with students in a way that I never thought possible, and connect with their parents who have, I share my story on curriculum nights, and I always, every year since, and it's only been 2, but I will have moms come up to me afterwards and share their stories with me. And so it's just, everything does happen for a reason. And I think we say that because you want to find something good that comes out of something bad. Otherwise, the bad wins. but being stronger and being able to connect better with people, and being able to just feel this sense of awe and humility for just the goodness of humanity. Like, that really is something I never would have known unless I went through this experience. Now, I don't want to go through it again, but it is something that that I'm glad to have put past me now.
I found out my sister had cancer when we were going out for the holiday, and we were going to go shopping, and she got a phone call while we were in the car and said she needed to take it. And it was the doctor telling her that her tests had come back and that she definitely had cancer. And she had not told me yet. And so this was the first time that I had heard about it. She felt a lump, and she went to the doctor right away. And they diagnosed after 2 mammograms. My sister went through a lot of treatments. She was diagnosed in 2017, and the tumor was graded at a 3A, so it had already gone into her lymph nodes. So at that point, she had chemotherapy. Actually, I think they did the radiation first to shrink the tumor, and then they did the chemotherapy afterwards. The first time she went through in 2017, they thought they had a full, that she was fully eradicated from cancer. And she had 1 full year where she was free from cancer and did not have to have chemotherapy. After that, the cancer came back in 2019, and it was in her lungs. She knew something was going on. She couldn't breathe as well as she thought she could. She was a singer. She was getting ready for her son's wedding. She was planning to sing at the wedding. She was having difficulty with breathing, but she was afraid to go and find out what was going on. So right about, actually like 3 days before the wedding, she went and they found that she had cancer in her lungs, and that she had fluid that was surrounding her lungs and putting pressure on them. So they drained the fluid so that she could sing. So she did sing at the wedding. And as soon as the wedding was over, she pretty much collapsed from the exhaustion and was in the hospital for 2 weeks. And then she was in the hospital again for another 2 weeks. So I think that summer, the summer of 2019, she was in the hospital for a full month. And it was, she had a lot of pulmonary issues from, from the cancer and it was creating all kinds of fluid in her lungs. It was the breast cancer that spread. So they do tests to see what type of cancer it is, but it typically is the same. But it can spread to other places, and so when it does spread to other places, they still call it breast cancer. The whole treatment process, it was kind of surreal because, I was praying and hoping and trying to do everything I could to keep her spirits up, trying to be the tough warrior, trying to help her fight. But at some point, you realize that sometimes the strongest thing you can do is to let someone go. So she had battled the lung issue in 2019. She was doing chemotherapy every 3 weeks for the rest of her life, is what they told her. She had to give up her law practice. Every 3 weeks she had chemotherapy, and for 1 week she would be completely sick and not able to really get off the couch. She felt ill, had a lot of side effects. So she had 2 good weeks basically every 3. So and this then became during COVID. So then, it was even harder because we were afraid to get her sick. So I didn't get to see her as much. But I went over to her house every Tuesday, and I would make dinner for her family and for her, and kind of celebrate with her. And then Wednesday she would go in for her treatment, and then I wouldn't see her again until the next time, 3 weeks later, basically. So she continued on chemo treatment. She every 3 weeks until 2021. In 2021, she started to have seizures, and they found that the cancer had gone to her brain. So in August of 2021, she had 10 days of radiation, and the radiation was extreme. It was really hard on her body, and it was almost, I would say that was almost not just, she was very strong, but she was in the hospital because of the side effects from the radiation. So she had the radiation in August, and that didn't seem to do too much. So by December, she had, suffered another seizure that was pretty severe, and they found that the tumors were growing even larger. So she continued to fight it, but eventually did succumb in March. So in March of 2022, she stopped treatment because she started to have more seizures. The tumors were growing, and she was no longer able to use her legs. And we just, it was a lot like torture to say, that she would go through anything more. So she did not want to make that decision. Her husband didn't want to make that decision. We're always looking for, what else can we do? What else can we do? But the doctors agreed that, to do anything else would just to prolong, just to prolong her agony, that the outcome was not going to be favorable. I think it's important to understand that, if the cancer is found at an early stage, it is treatable. But once the cancer is, once it metastasizes, that the chances are that it is not going to go away. And so when people ask, if there's an end to the treatments, there's not. So try to. I don't know. I'm not sure how I gotta get this message straight. What's the message that I want? There's this. I think there's this conception. There's misconception that people wearing pink are fighting cancer. And it can be won. There comes a point when it can't be. No matter how hard you fight, once it metastasizes. It's just a matter of time. You can have a lot of quality to your life. But it's going to be limited. Your life is definitely limited. I think it's important for people to do the self-checks. But I think it's important for everybody to know that, a person, especially with breast cancer, once it's been initially diagnosed, sometimes people get a lot of support, but that support needs to continue because sometimes people have treatment for the rest of their lives, and it can really affect the quality of their life. And so I felt like I was walking alongside my sister, and we walked together for 5 years. And I think when you walk with somebody, you know, a piece of you definitely dies, and then a part of you is, you know, kind of having that survivor's guilt maybe, where you feel like you need to take stock of what you do have and appreciate it more and try to live your life more fully, kind of even on behalf of that person who no longer is able to. I think people need to remember that everybody reacts differently to interventions. So, you know, one person might have a better time with chemotherapy than another person. So each person is going to react differently, and sometimes the chemotherapy is, you know, the chemotherapy, the radiation, all of these treatments are really, you know, just really hard on the body, and you just never know what side effects will come from it. So appreciate, you know, the time that you have with your loved ones, and be, you know, gracious to them. A lot of times they look on the outside like, you know, kind of normal, but on the inside they're confused or tired or, you know, anxious, and so you just never know. So try to be, you know, gentle and kind. And so my sister was a light to many people, and to me especially. I felt that I lost my best friend, but we did the best that we could. We tried to fight and have a sense of humor. My sister would do lots of blogs where she was the warrior queen and she was fighting against the dragon or the hydra, and that was kind of the theme of the conversation. So we didn't really talk about, you know, cancer and say the word cancer. We kind of played with it, and, you know, imagined the kingdom with the dragon being slain. And it was a lot of fun doing that, and it was also, I think, a good coping mechanism to kind of get out of the serious drama of the situation, and to kind of lighten it up by using, you know, the theatrical guise of, you know, role playing. And so I would encourage people to, you know, try to find a sense of humor, try to journal about it in a way that helps them, you know, release some of their feelings, and maybe use fictional characters to help with that. So my sister was 4.5 years older than me, and she passed just before she reached her 60th birthday. So that was a very sad moment. She was a lawyer. She always advocated for the underdog. That's kind of a family trait. She was a guardian ad litem. She represented children who, you know, were going through rough situations in their life and did not have adults that could take care of them appropriately. She was a good person. She adopted lots of dogs. She was a dog lover. She always talked about her fur babies. She had 3 children. She was very generous. You could always call her and talk to her and get advice. She was really a good person. Yeah. So I miss her. I miss her a lot, and she was very fun. She had a lot of dramatic interests. She loved role playing. She loved going to the Renaissance Festival, dressing up for that. Yeah, she was an excellent cook. She always made really wonderful things. I was always the one who cleaned up the kitchen. She would cook. So I had my role. My role was to clean, she was the cook. So.